morning for a special kind of healthcare boot camp.
Yeah, they're trying to increase the number of minority researchers investigating health disparities and to hopefully improve health equity among people of different races. Our Josh Sprider joins us live this morning from the site of the 9th Annual Health Equity Leadership Institute with...
Adam and Danica, good morning. A big week here on the UW-Madison campus. I'm joined this morning by Dorothy Farrar-Edwards. You're a professor here, and thanks for joining us this morning.
Hi, thank you for having me.
So you're a professor, but you're also the director of a very special institute you guys have going on this week.
Yeah, so I'm the director of the Collaborative Center for Health Equity, which is leading the Health Equity Leadership Institute. This is an annual event where we bring junior scholars, assistant professors, and postdoctoral fellows from all over the United States to come to Madison to learn about the great work that we're doing here in Madison around issues of health equity, but to also develop the skills to be successful in their own research.
So this kicks off today, and what can people kind of expect? I mean, what are you guys working on?
So we're working on a number of things. Basically, this is like a boot camp. We're trying to help these junior faculty and new investigators build the skills to be very successful in the competitive research environment. Most of our research relies on funding from the federal government, particularly the National Institutes of Health, and that's very, very difficult to obtain. So we really work on skill development in the area of grant writing, grantsmanship, how to take a research idea and develop it into a fundable project. But in order to do these projects, you have to know how to connect with people, because we're really talking about health conditions of people who may or may not have access to healthcare systems or have not been present in the research process before. So we spend quite a bit of time with our community partners here in Madison and Milwaukee to really provide firsthand experiences for our Healy scholars in how to build good partnerships and actually also respond to the healthcare needs of the community. So this is all about relationships. Successful health equity programs are built on hearing the voice of the community and turning those concerns into fundable, actionable research.
All right, Dorothy. Well, thank you so much for joining us. She'll be sticking around, and coming up in our next half hour, we're going to talk a little bit about the importance of having a program like this and also some challenges. That's coming up just after 6:30, guys.
Some of the preparation, the research that starts today ends up impacting people decades to come. All right, Josh Sprider reporting live from campus this morning. Thank you.
6:05 right now, and the Janesville City Council is considering an implementation of a